What is up, everybody? Jeremy here. And guys, I'm very excited for our conversation with us today as we have Catie Harris with us today. She is a NursePreneur Mentor, and she's empowering thousands of nurses to really monetize their expertise and knowledge and to give care in a different way. Catie, thanks for hanging out with me today.
Yeah, thanks for having me.
Oh my gosh. So for our audience, I'm going to just kind of give them a heads up of how much of a nice person you are, because this is our second chance at doing this interview, because I had such a terrible migraine last time I could barely see. And you were nice enough to say, hey, totally fine, I'll reschedule it. So thanks for doing that, Catie.
Yeah, absolutely.
So I would love to hear a little bit about your story, because you started out in the nursing area, but now you're helping nurses to do something a little bit different. So tell us a bit about your story.
So I mean, I've been a nurse for 20 some years now. I think it's closer to 30, but working in the hospital and really just wanting to do something more than I was allowed to do, right? Because in the hospital system, it's more kind of, this is your lane, just do what we tell you and don't do anything additional. And that's not the type of person that I am. And a lot of nurses aren't. We have big ideas and we're frontline workers. So we see the problems and you want to talk about the problems and solve the problems. And they're not always very well received. And I'm going to go out on a limb and say they're rarely well received, because most organizations don't like change, and a lot of the change that needs to be done in the healthcare system is pretty dramatic. So, I needed to branch out and do something else. So when I started looking, my thought was, well, what can I do? What can I do as a nurse? And I felt like I had to go into start a travel agency or do MLM and sell Rodan and Fields or something. And it wasn't what I wanted to do. And I thought there has to be something that nurses can do.
I will say my first job when I left teaching was MLM, and it was a multi-million-dollar nurse that taught me how to do that. So anyway.
There you go. See? And I'm not saying that it can't be done. It's just that I'm not the person to do it. And it wasn't, I wanted something of my own, not to kind of push other people's products.
Right.
So, and it was, that was the thing that I started looking around thinking, well, I must be the only nurse who's ever thought of this idea or something stupid like that. But because I didn't really see other nurses in business until I really started looking. So that's when I started, let me really explore this question of what I can do, what can nurses do, and started finding those nurses. It's hard. It's, it's hard to find them because they don't always advertise that they're a nurse. And that's when I started my own podcast, and just talking to the nurses just opened my eyes. I was like, oh my God, this is amazing. Nurses are amazing. And so many other nurses could do this.
So I want to talk a little bit about, you mentioned, that the hospital kind of setup, how things can get a little contentious. And I imagine, you and I've talked about this off of this interview a bit, is, sometimes you have a lot more experience than other people and you have to advocate and things like that. And so I'd love to hear for you, what some of those moments were like, when you had to, do what was right or kind of advocate for yourself as a nurse.
Yeah, I mean, I can tell you that I grew up with neurosurgeons, basically. So as a nurse, I worked with neurosurgery patients, and then as a nurse practitioner, I worked along with the neurosurgery residents. And I'm the type of person, again, that wants to learn everything. So I wanted to know everything the residents knew. And so I would insert myself, and they were more than happy to dump all their work on me. So I loved that, and it was great. But it got to the point where I was better than, the new residents coming in, obviously, because after years and years of doing the same stuff, I knew the system. I knew how to get things done. And, I could operate, I could do all the lines, I could do everything the neurosurgeons could do, but I couldn't get paid and I couldn't get the respect that the neurosurgeons could get. So it got really frustrating. And, I still had to sign in and out with the intern. The intern's the lowest man on the totem pole. And after years of this, and I now have a PhD, I have an MBA, 4 master's degrees, and I'm still and having to report to this intern. And I remember at one point the intern was like, I'm telling this story of how I dealt with a patient, and he's like, well, that's not how we do things here. And I'm like, look, jerk, you see that book over there that says how we do things? I wrote that book. Tell me that's not how we do things here. And that's I was just really angry and pissed off in general. And it was just really frustrating. And I knew I had to do something at that point.
Well, I think the thing that's interesting too, and this is just my own perspective, first of all, so you can correct me if I'm wrong, but it would seem to me that, nurses would also know the patients a lot better, right? Because, you're with them a lot more. You're handling them day to day. The doctors come in, they check, and they do what needs to get done when it needs to get done, but they're not spending as much time with them as you are.
Right. And even as a nurse practitioner, because I'm working at the same level as the residents, I wasn't with the patient all the time. So I went and talked to the nurses, and there's some nurses that I'm like, oh my God, thank God they're on because they're awesome and they know everything. But I relied very, very heavily on their assessment, what they said, what they think. I would get a report from the residents and then come out to the nurse and be like, all right, what's really going on here? Because there's things that you say to the attendings that they don't want they don't want to know the real story sometimes, the real problems. So, so they were essential.
I guess when you look at it, what skills would you say from nursing have translated best to business? And I guess what skills do you feel like you've had to learn because they didn't translate as well to business?
So I would preface this one with I had an MBA, and the MBA didn't help me at all for a startup, for going out in business and doing a startup. It was completely useless. But I thought when I first started out that I needed to go back and, restudy all my tax accounting and finance numbers, and they were just not helpful. I mean, they're great if you're a multi-billion dollar corporation and I could project 5 years, but I couldn't project 5 hours into my business. So, the traits really as a nurse, one, I knew how to do workarounds, get things done, work on a shoestring budget or no budget for that matter. We have nurses that have created products just because they didn't exist, and they would go into the supply room and be like, well, if I do this and this and tape this together, then, I can create this. And a lot of products that are out there have come from nurses who have done it, or people who have taken their ideas and and
it's like nurses were the original MacGyvers.
Yeah, yeah, exactly. So I mean, they have that entrepreneurial spirit. And one of the things that when I first went into business and marketing, everybody's like, well, you have to talk to your audience and really listen to them. And I'm like, well, that's like nursing 101. Like, you go in, listen to the patient, hear what they have to say, let them say what they need to say, let them say what they want, and then you give them what they need. And when I was in entrepreneurial circles and people were talking about, what they were doing, I'm like, this is what we do every day in nursing. We just don't capitalize on it.
So I guess when you look at that, like, as well, another big thing nurses have to deal with in a different way than a lot of us too, because like I know a lot of my nurse friends, I'm just like shocked with the hours they work and what they put it is burnout as well. So how did you handle that, and how have other nurses handled that? And I guess, has that been a motivating factor for business, or what does that look like?
Yeah, I mean, I can't say I handled it well, because I spent a couple of years just being really angry, irritable, just not a nice person. I would walk into the hospital and just be miserable. And I didn't recognize it at the time as burnout, but there was just intense frustration. I would push everything down and, internalize it, but then externally it was making me miserable. And I do see that a lot with nurses today, because the cost of nursing is tied to the bed. If the bed's not filled, then they say, oh, well, we don't need you today, don't come in. Or during COVID, there were some hospitals that were hopping, right, because the hospitals were full, but there were a lot more hospitals that had no patients whatsoever. So they just get rid of all those nurses, and then when the patients start coming back, they're like, oh, come back. And it's just like they've destroyed the culture that we used to have. So the nurses are recognizing that, and the burnout is quite intense at this point.
I think that's one of the things that's interesting you point that out, the bed thing, because I think that's something people didn't realize until COVID, right? Because we talk about, oh my gosh, X percentage of the beds are full in these different places, and it's like, well, they have to be. That's how hospitals make money. So right. I think at the same time, like, we realized how little of an understanding the general public had of how that works.
Right. Yeah, absolutely. But, it's that constant feeling like, and we never had that before. I'll say, when I first graduated nursing school in 1996, there was this weird period where there was a surplus of nurses, and I couldn't get a job anywhere except in like Roswell, New Mexico or something. I ended up going to South Texas for that job. But ever since then, that one blip of time, which happened to be right when I graduated, there has been a deficit of nurses, and continues to be a deficit of nurses. And the irony is that there's more nurses today than there ever were, and yet the deficit is way bigger. So there is this sense that not only is the nursing job much harder, but the prices don't keep up either, right? Like I might pay a social media manager $40 an hour, and that's what the nurse gets paid, but the social media manager doesn't have to worry about getting beaten up by the patient, bitten, shot, whatever, exposed to horrible diseases, life-threatening stuff. You're not traumatized by the story, because some of the stories that come in from the patients being abused, beaten, whatever, it's a lot. We all need mental health, and we don't get that either.
That's like, I know that one of my really good friends, once she had kids, she went to per diem too, because she could just, make more money, and the schedule is a lot different. So I agree there needs to be some changes in the system, but I guess that's why, you're saying, hey, let's start businesses then. Let's look at this a different way.
Right, exactly. Because to be honest, I don't think that the system's going to change. I think it's going to collapse. So for nurses,
That's a scary thought.
Yeah, well, it's not doing well. I mean, and if you look at the vacancy rate and the turnover rate of nurses in the hospital, either they have to learn to function without nurses, or something's got to change dramatically, because it's not you can't keep going the way it is. I mean, some places have like 50% vacancy rates, so they're shutting down entire wings of hospitals.
And is that just because they're not paying well, or because like what is causing that?
Part of it is pay for sure. I mean, that there's staffing agencies and travel agencies that will charge like $150 an hour, and it's a 60-40 ratio, so the nurse gets 40% of that, and the agency gets 60%. But the hospitals are willing to pay that, and then you have a whole unit of travel agencies, so the staff that's left over there, it's exhausting because everything falls on them, and they're constantly training, and the travel nurses get to pick Christmas off, and they're not going to work nights, and they're not going to work weekends, and they're not going to work holidays, so that falls on the senior staff, and it's just kind of like, well, why don't I just go staffing? So now you have a whole group of staffing agencies that don't have any commitment to that unit to make it better or whatever. So
that's a really important point too, right? Because to be part of a group, right, is to actually take responsibility for that group. And if you are kind of, in and out when the times are good or when it's a holiday, whatever it is, like you're not really taking responsibility for that group, right?
Right. Exactly. Yeah, and I don't think they recognize that culture is really important. When I was, I hate saying like when I was a nurse, when I was a nurse 20 years ago, I worked in a unit where we were paid at the 50th percentile, and down the street there was a hospital where they paid at the 80th percentile. So it's a big chunk of money, right? Mm-hmm. But nobody wanted to work there because my unit had almost zero turnover. So it didn't matter how much they paid us. We were family. That was my second family. I loved going to work. It was fun. We went out after work together. We had drama together. It was fun. I didn't want to go on vacation because I didn't want to miss a day at work.
So let me ask you this, Catie. So then this is the problem we're highlighting, and this is why nurses are going to business. So let me ask you this: like, how does moving into business connect a nurse to their original purpose? Because I think you go into this because you really want to do something, and it sounds like, because of the system or because of time or because of hours, that kind of gets beaten out of you a little bit.
Yeah. I mean, your purpose. I think that's the true essence of burnout, is that nursing has lost its purpose. So now we like check boxes and, pretend to cater to whatever, hospital management du jour's issue du jour is. It's this constant cycle of people moving through. You never fix the problem. You're always kind of putting out fires, and what is your purpose in all this? How are you actually helping people? And most nurses really do go into it for a purpose. We've had people transition from corporate or finance because they wanted that human interaction. They wanted to do something useful and purposeful. And I actually have one of my students, he was management consulting, then went back to nursing school in his 40s just to have that human contact. And he was there for like a couple of years, and it was like, oof, this isn't human contact. This is like human, like, I don't know, whatever. So he moved kind of out of nursing again. So that I see that happening over and over again. And I think it's because there lacks a purpose and bigger impact or bigger community that we used to have.
So I guess when you look at it, then you talked about that management consultant going into nursing, coming out of nursing after a couple of years. With a lot of the nurses you talk to, like, how have they found their purpose outside of nursing? Like how have you seen that happen?
Well, a lot of them find their purpose in nursing, but they're unable to express it or pursue it or whatever because the system keeps us doing what we're doing. So, for instance, like the inpatient and the outpatient world are completely disconnected. So we'll see, let's say you take an oncology nurse who sees cancer patients, and then they go out into the world. They disappear and then they come back when there's a problem that could have been solved if somebody had been managing this, that, or the other thing. And the nurses hear those stories over and over again. They understand the problem, but the hospitals say, and maybe rightfully so, I don't know, but we're not responsible for the patient after they leave our doors. An outpatient doesn't have time to manage the patient, so there's this complete disconnect and lack of care coordination. So that's one area that nurses can really step in and create solutions.
When you've talked to a lot of the nurses you talk to, I guess what careers, business wise, do you see them fitting well with, once they leave the profession?
So, and we like to say we keep them in the profession, but, there's the care coordination. There's positions such as patient advocate, where they can go with the patient to medical appointments, to their chemo appointments. We have concierge nurses that pick patients up from surgery, take them home.
That is so vital, by the way,
Yeah.
the care consult. So my mom had a stroke in 2010. She's still pretty disabled to this day, but my poor dad, he didn't graduate high school, so he has he's a nice guy, but he's a low level education and everything besides that. So like he was really struggling without somebody to really guide him. So we found a friend that was a nurse to just help us because, like you're saying, it's vital to have that person.
Right. And you don't know what you don't know. And there's actually a lot of free resources out there, but nobody will tell you because everybody's so busy, they don't have time. And that's actually one of our programs is called Chronic Care Management, and it's a Medicare program. And the funny thing is that Medicare spent billions of dollars to find out that if you actually talk to the patient, you can help keep them out of the hospital. So, whether that was a waste of taxpayer dollars or not, I mean, it seems pretty common sense to me. But, now they have this payment where they'll pay providers $64 per patient per month to actually call and talk to them and make sure that they got the resources that they need. So that's a business right there that we function in.
And I did cut you off. I apologize when you're talking about other types of professions nurses go in. It's just that for me, that was something like, oh my God, that's so needed. But you were talking about the different types of professions that you've seen and businesses you've seen nurses do well with outside of nursing.
Right. The other two that are really popular are IV hydration and med spa. And those two, I think, are the easiest for people to wrap their mind around. I'm not sure it's the business that all the nurses want to go into, but one, they can see the profit on the other side of, if I put this money in, this is, what I can make. Whereas if you go into some other businesses, it's especially like coaching or consulting or something, sometimes it's hard to wrap your mind around, like, how can I make money off of this, or who's going to actually pay me? And you have to go through all those types of mind games and stuff. But those two are popular because they're booming right now, and nurses will. I think a lot of times they're sitting at their job that they're hating at the moment, and they start calculating. Well, this guy down the street charges $300 for an IV, and if I do 10 IVs, and I can make $3,000 a month and 90,000 a month or something, and they don't factor in other things like startup costs, marketing, legal fees, that kind of stuff.
Well, I will say, just from my personal experience, I had some regenerative medicine done a couple years ago by a nurse practitioner, and my knees and my shoulders are in like incredible shape after having some PRP, the platelet-rich plasma. I feel like it's a tongue twister. I have braces, so I always talk funny when I say that. Platelet-rich plasma. So like, I think that's a regenerative medicine. Seems like it's another great area for nurses as well.
Oh yeah.
I'm curious, Catie, because, and I may be totally wrong about this. I feel like the nursing mindset and perspective and what you see would actually go really well into consulting. Do you see it that way or no?
Yeah. I'm working with a couple of consultants right now. One of the nurses, she does staffing turnover, how to stop your staffing turnover, which all the C-suite, the corporate types are interested in, because she originally started out, she's like, I want to help nurses that are burnt out and they have mindset issues. And I'm like, yeah, corporate medicine doesn't care about that stuff. They care about numbers, right? They care about the staffing turnover. How do we stop the staffing turnover? And it might be like we work with the nurses to do this, that, and the other thing. But so helping them to reframe what they're doing is a large part of what I do.
And how are you helping nurses the most now? Because I know you are really helping other nurses to make an impact. So how are you helping?
Yeah, so basically, I listen to the nurses, what they're looking for, what they need help with. We've built IV hydration and med spa based off of them saying they wanted those things. We brought them chronic care management, even staffing agency, how to create your own staffing agency types. So those are kind of what I consider business in a box. And then I have my own personal private clients, and then we have coaching for other clients that, I'm not real sure how to help. I'm like, well, that's not my area of expertise. So I find them coaches to work with. But I have a framework that everything is based off of. So, following this kind of like 12-step framework to put the business together and put the marketing together. And then the coach helps them with very specific angles and maybe networks and helping them to reach the right people. So.
Cool. Well, Catie, I've really enjoyed our conversation today. For people listening, if they want to connect with you and they're going to want to learn more about what you're doing, where's going to be the best place for them to go?
Yeah, nursepreneurs.com or any of the social media handles will take you there at nursepreneurs. So.
Cool. Catie Harris, thank you so much for hanging out with me today.
Thank you.